Good day, Chairman Pitts and Ranking Member Green. On behalf of our foundation, Mrs. Beasley's Polka Dot for Women's Rights, which focus is free contraceptive for all women. Its 25-member organization and 100,000 plus patients and families we represent. I want to thank you for holding this hearing, allowing me the opportunity to testify regarding H.R. 1904, the Government-Funded Contraception Act. My name is Oliver Gallegos, CEO of the Birth Control Action League. I am here today representing one of this nation's premier organizations supporting the prevention of unplanned pregnancies for teens and single mothers. Our mission is to build and strengthen the capacity of community coalitions to reduce unwanted pregnancies and save the taxpayers' dollars. Although free birth control has been around since 2010 with the health care reform, it's still an issue whether the government should be responsible for contraceptives. State funding for this health issue affects unwanted pregnancies from preteens to adults, victims of rape, and older women who are still able to get pregnant but suffer from life-threatening health issues for the unborn and their own lives. If each state government paid for contraceptives, it would help the nation. This impact of state funding was proven in the state of Colorado. They proved it lowered abortions, teen pregnancies, and negative social matters, which dominoed to the development of the child. Many legislators agree that women in each state should have free access to contraceptives. All contraceptives. Representative Cory Gardner of Colorado embarked on ceasing funds to Planned Parenthood in Colorado. He changed his negative opinions when he found out Planned Parenthood and accessible free contraceptives had a positive impact with proven results. Researchers and experts in adolescent behavior have been studying teenage risk-taking for decades. Since risk is a key factor in teenage pregnancy prevention and a key difference between the approach, theory, research can help determine the better approach. Taking a risk of avoidance approach to a teenager sexual behavior presents abstinence as the best choice. However, other people maintain that teen sexual behavior is inevitable and that teens need to learn risk reduction to avoid unwanted pregnancies. The Colorado Department of Public Health and Environment announced the public-private partnership on access for contraceptives decreased numerous controversial social issues. The 4-year trial for free contraceptives decreased teen birth rates by almost 50%, and the teen abortion rate decreased to nearly 35%. A volunteer private funder provided long-acting reversible contraceptives to low-income and uninsured women. This fund provided money for the IUDs and hormone replacements. Legislators discovered statistically the state saved close to $6 to every dollar spent due to this generous provision, which started in 2010. Can we say this about other programs? The proposed changes in free contraceptive policy nationwide do have some obstacles. Almost half of nearly 6 million pregnancies are unplanned, unfortunately. Half end up in abortions. On the other hand, the unintended surviving pregnancies are costing taxpayers over $10 million per year due to being unplanned. That's why the Affordable Care Act included birth control without copay, because it was a benefit to taxpayers in the long run. However, some federal sponsors feel that IUDs and hormone replacements are more effective. Federal sponsors have proof. Federal sponsors believe that these methods will not have to hinder women to remember to take the pill every day and have the hustle of prescription refills. Nevertheless, these forms of contraceptives are quite costly versus birth control pills or other over-the-counter methods. Women who have insurance but fall in the category of no coverage would have to pay out of pocket. These women would either pay for birth control pills or use none at all. There are very few groups that disagree with the policy of free contraceptives for women. The Supreme Court ruled that some corporations can opt out to free contraception due to religious beliefs. Modern conservatives believe that education, celibacy, and permission with approval from their parents or guardians for minors should be the focus. Religious groups such as the Roman Catholic Church also totally disagree. They believe they should focus on the above as well. They also believe that it makes the youth believe that premarital sex is acceptable and celibacy is extinct. Overall, the risk of not enacting override the legislative funding issues. If free contraceptives are offered to women, it will save the government with a long-term effect. We could use the money we would be saving to focus on the education of our children, helping the environment, and assisting our elderly. Some women believe free access to contraceptive or contraceptives give them more control over their sexuality. These same women believe it is another step to women's rights. Thank you very much for allowing me to testify before you today, and good day.